All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant, and I'm here to deliver another lecture of Health Education Lecture Series. As you know, in these Health Education Lecture Series, we are discussing a systematic study, sorry, systematic study of how life is created from life. And this how life is created from life is serial type of lectures we are delivering since beginning of the life from sperm and ovum and onward, its development and the mother's womb, how it reaches to the uterus, then how it develops, what are the special characteristics it attains during mother's womb. And under those conditions, I have discussed each and everything. Sometimes there are some complications, though it's a natural process. It's a natural process, but even then, sometimes there are complications. Complications may be hereditary, complications may be acquired. Acquired means because of our own reasons. We are responsible by one or the other reasons. We are responsible for those abnormalities in the fetus or in the development of the child in the mother's womb. We are responsible for that. So, complications of the placenta, complications of the all the umbilical cord. I told you about that, and sometimes the formation of the placenta has a different type of abnormalities, and then their functions. What type of function the placenta is carrying out, and one type of function is, and umbilical cord is carrying out, and what is the structural formation of placenta and of umbilical cord. And there were some you can say the astonishing facts about the placenta. Those we have discussed in these lectures, and ultimately the function of the uterus in that portions before a child is attaining its own position inside the womb, uterus, condition of the uterus, and then after that when this child is developing inside the mother's womb, then how this condition of the uterus from inside changes and from outside it changes, and what are the differences, how we can diagnose all these things, how we can understand all these things systematically I'm discussing with you, step by step, lecture by lecture. All these things are going on where decidua, endometrium is converted into decidua, and decidua capsularis, decidua basalis, decidua vera. Everything has been discussed in that one. And spotting, bleeding, what are the complications sometimes happens during pregnancy. Everything has been discussed in these conditions. And after that, it's not only that the complication only the mother suffers, that the complications only mother the systems show us. No, there are complications with a developing child feels inside mother's womb. These are the deficiencies, these are the structural type of complications, and these are functional type of complications. And in our previous lectures, we have discussed about the functional type of complications a child has to suffer. And then after that, the functional complications a child has to suffer sometimes in mother's wombs. And under those conditions, we have discussed some anomalies. These all conditions are known as anomalies. So we have discussed about the anomalies in a child, in a fetus. Basically, there are separate stages of the development of the fetus. When it just comes into the uterus from the fallopian tubes after being fertilized. An ovum, after being fertilized with the sperm, when it enters into the uterus, it's known as embryo. And after that, after 12th week of pregnancy, then it is known as a fetus. And from that onward, up to 40th week, till it's resident in the uterus, it is known as fetus. So this fetus structures abnormalities. Nowadays, we are discussing one by one, in this way, that what are the fetal abnormalities a child has to suffer. May or may not be, may or may not be in a healthy woman and a healthy, it's you can say the parents. Then there may not be any problems, but sometimes there are problems which are known as congenital problems, which comes from the mother's side, from the father's side, and for which we cannot do anything. We can just manage the things. We can manage those things by our means when the child is born. But some of the problems we can recognize, even if these problems are congenital, means coming from the back generations, congenital problems. But we can detect them. Nowadays, we are competent to detect all type of problems which are coming generation to generation. Genetic problems are known as congenital problems in a fetus. But some of problems are the inherited problems from our acquired problems. In other words, you can say, use the word acquired, which are because of our own reasons. We are responsible for that, for diet side, by environment side, mental side, physical side. Many other things are related to this one, so that the normal development of the fetus is not going on in the mother's womb. But there are some problems, and we are responsible for that. So systematically we are identifying all those, we are pinpointing those problems which are due to our own reasons, and those which are due to our own reasons, we are capable of, correcting those things. And what we can do for that systematically, one by one, when I'm discussing the anomalies of the fetus, I'm discussing side by side what we can do for that, and what we should do, which has not been done yet. Even then, most of the things we can recover in mother's womb. But after that, some of the things remains in the fetal body, that is not recovered even within 40 weeks of pregnancy. And when the child is born, though we can identify it, we can diagnose it in the mother's womb, but even then we are not able to correct that. We are not able to diagnose properly, and sometimes we are not able to treat that one, you can say. Okay, though the means are developing nowadays, even heart surgery has been developed to the extent that if a child is having any heart problem, heart valvular problems, sometimes these are surgically recovered inside mother's wombs. And there are many other problems which a surgery can correct even when the fetus is inside the mother's wombs. But we are talking here that in a natural way, but some of the problems are not recovered even during the 40 weeks of pregnancy and the child born with that. And in that conditions, we have discussed about the anomalies in the heart already. I think 3 4 lectures has been done about that one. That is the foramen oval, and the changes in the heart muscles, and the pacemaker of the heart, that is a SA node, AV node, bundle of his. All these things we have discussed systematically, one by one, in many lectures. So these are the abnormalities or the anomalies of the heart in a fetus when it is still in the mother's womb. And to these things we have already discussed that some of the things which are recovered naturally in the due course of time, they are recovered. And that specified, we have already specified the time periods that this foramen oval, which is a normal physiological functioning created by the nature, is recovered within 6 months after the birth. But sometimes it is not. Sometimes it may take about 18 months to recover, and sometimes it does not. Sometimes it does not. There are many more various other factors by which this foramen oval remains patent, and we are unable to recover that. And then, under those conditions, we need the help of the surgery, and we recover that. Nowadays, the surgery has advanced to the extent that we are able to recover all these things. So in this way, we are at the point now that we are discussing. Yesterday we have discussed about the hydrocephalus. In a few words I will discuss about this one, so that, because my purpose is not to just go deliver my lecture and go off, that's all. No, my purpose is that whatever I'm saying in these lectures, my community, because they are not from the medical grounds, they do not know about the biology of this body. They do not know the anatomy of this body, physiology of this body. So, and even some of the medical terminology, I try not to use the medical terminology. I try to use the simple English, which everybody can understand. As we teach in the medical colleges, it's different. It's different from that, because the class sitting in front of me, they are well known to the biology, and well known to the anatomy and physiology of the body. But here, I know that my general community is not aware of all these things. So that is why I try not to use medical terminology. I try to use the simple English language, so that sometimes I do not find any word what to say about that one. And even I'm confused about that, because we know the technical words, but we do not know the general words. Sometimes it happens. It happens because it's a routine. So in this way, sometimes I use Punjabi words sometimes, and when talking into English words. So in this way, my purpose is to convey the message to you, to convey the knowledge of this body, its functioning, how it is formed, how it works, what are the problems, some natural problems, some created problems, and what are the created problems, and how, what are the reasons behind that, then how we can correct all those things. So systematically, one by one, I'm telling you all those things. So yesterday we have completed the chapter of hydrocephalus. And about hydrocephalus, I have given, within the today's time, I would like to again repeat this thing, because it's an important thing. It's an important thing in our child's life. So that must, everybody should know about this thing, that hydro means water and cephalus means head. When there is excess water, there is water everywhere inside the body. Every cell has the water, about 72% of water in every cell. And the others are the cells and the other minerals and salts and all that. And the same way, there is a water in the brain. There is a water in each and every organs inside the brain. Because I told you, inside the brain, there is a type of village. Our skull, the scopary, this skull, is a type of a village. And as the village has different homes, different residents, houses, and every house has its own boundary wall. The same way, cerebrum, cerebellum, mons, medulla oblongata, all I have told you about that. These are the contents of our brain. It's not only one thing in the brain. So many things, they are performing different functions inside the brain, to control the functioning of the whole body from head to heel. And they are having their boundaries. They are having their boundaries, that is known as meninges. And meninges, just now you might have heard about the meninges, sarsam, फलाने नु sarsaam ho gayi hai, meninges. Okay, those meninges, when there is a swelling inside those meninges, those membranes, this is a folded meninges, just like a glove. In our rajai, we use the glove to cover. Same way, these meninges are having a glass type, a covered, folded cover, a double layered covered, you can say. And it houses the organ, and also in the circumference outside with double membrane, it has some fluids, so that every organ of our body is contracting and relaxing, contracting and relaxing, and contraction and relaxation is life. जिंदगी चलना जिंदगी का नाम है. और अगर कोई मूव नहीं, if anything is not moving, that's dead. So every cell of our body is moving. The same way, all the organs, even in the brain, they are moving. And to facilitate this movement, nature has provided a covering, a boundary wall to every organ. Cerebrum has its own, cerebellum has its own, mons has its own, medulla oblongata has its own. They all organs are having their boundary wall. That boundary wall is our double layer, and those double layers, in between that layer, they contain the fluid. To facilitate, there should not be any friction between the two layers. Friction, and moreover, they can facilitate the contraction and relaxation of each and every organ. Second, we told you about this one, that this fluid moves inside the streets, just like there are streets inside the in the villages. And those streets are named here in the brain ventricles. So ventricles are the streets in between all the organs, in between all the houses, all the homes, and these are four type of four ventricles, and they are in between the organs, in between the organs, and their branches are moving inside the organs, and ultimately all these ventricles are connected to the periphery. I think the periphery is a good word for that. Firni, in Punjabi, we say that in our all the villages are having firni. Every village has firni all around that one. The same way, that is known as periphery. So that periphery in the skull, you see the skin, that is scalp. Underneath is bone, that is skull. Underneath that, there is a gap. There is a gap that is known as arachnoid fossa. And arachnoid fossa is a type of, you can say, just like veranda. I told you yesterday this thing. If you see your mouth, lips, you open your lips, and there is a line of teeth, upper teeth and lower teeth. And between the teeth and the cheeks and our lips, there is a gap. That gap is known as veranda, vestibule. In mouth, it is known as vestibule. The same type of veranda is in the brain after the skull inside, and that is known as arachnoid. Arachnoid is a veranda of our brain. First of all, when we go in any home, first of all, we enter into the veranda, and then go inside the rooms. The same way, this is arachnoid fossa. This is the veranda of the brain. So means all the streets goes to the periphery, that is the veranda, and all the streets attached to each house in the village. And what they do, they first of all, every person who is going to any house goes through the streets. And what is going? Oxygen. What's going? Food materials, which is coming by the blood. From the circulating blood inside whole body, it enters into it in the ventricles. And from the ventricles, these organs inside the brain, they suck their materials. They take their oxygen, they take their food materials for the normal go of life, for life. And ultimately, from the same street, we put our garbage out. By the same streets, we go out, we come in, and all these things happens. And our garbage goes out from our home via the streets. The same way, the garbage produced by each and every organ. in the brain and all over the body. In the brain, we are talking about the brain. So, garbage produced by all these organs inside the khopri, inside the brain, is released into the ventricles. And ventricles has that fluid that is known as CSF, cerebrospinal fluid. And that cerebrospinal fluid has link. It's moving all the time. It has link to our vertebral column. Read the haddi, this vertebral column. And the skull is united with the vertebral column by the bones and by the hole. There is a one hole in the skull in the backside in the occiput that is known as foramen magnum. Do not confuse. When I talked in the heart, it was foramen oval, and this is foramen magnum, bigger one. Magnum means bigger one. A big hole in the skull. And the vertebral column has its first vertebra, which is like just like we attach the trolley with the tractor. The same way this thing is fixed into the skull, and inside that atlas vertebra, inside that first vertebra, and also the all vertebrae of the vertebral column, there is a canal. There is a canal, tunnel, you can say, gufa, and in which all our vertebral nerves, which are issued from the brains to control the every organ of our body, passes into the vertebral column. The same way, to facilitate movement, of these nerves, and also to collect the garbage of these nerves, and also to supply food to the nerves everywhere. This fluid is there that is known as CSF, cerebrospinal, combined name. Cerebro means head, cerebrospinal means vertebral column. So cerebrospinal fluid. So this fluid from the head to the vertebral column moves always, continuously. It is in movement. If water will stuck in a pond, it will smell filthy, foul smelling. But if water is flowing in a canal, it's not filthy. There is no badboo. There's nothing like bad smells. It goes on. The same way, if this CSF, cerebrospinal fluid, if it is stuck up somewhere, if it is stuck up somewhere, then it will be filthy. It will be foul smelling. It will create, in a medical term, inflammation, sore, swelling. It will cause that type of problems. And when there is a swelling, it will block the way. If anybody stop his tractor in the street, ultimately it will create a problem for the passing by. People will not pass freely because in the street somebody has stopped his tractor. The same way, if there is a swelling anywhere, if there is a collection of this fluid stopped, stuck up in one portion of the in this way of skull and also the vertebral column, wherever this collection will be, it will produce hurdles. It will produce complications wherever it is. The same way, when it is in the skull, this is known as hydrocephalus. When this water is blocked inside the skull, and maximum water is blocked over there by hook or crook, by some reasons that we have already discussed yesterday. Some reasons are congenital reasons, genetically coming from the parents, and some reasons are acquired reasons. Some are the acquired reasons, means it was our fault. Because of our reasons, there are some problems that the water is blocked inside the brain. In this way, in this way, I told you yesterday that the normal quantity, everything inside the body has its normal quantity, average quantity in any person. So CSF in a normal human being, it has a normal quantity of 150 milliliter to you can say 120 to 150 as an average. You can say it's a normal quantity which continuously flow onto, and it is replaced three times. Everything is replaced three times. Suppose there are 10 members in the team. I can simplify it. There are 10 members in the team, and one member is going, the next member is coming, one member is going, next member, and the last one, when the last one goes, means one cycle is complete. And this CSF continuously flow from skull to the vertebral column and complete three cycles in 24 hours. Means this is the speed. This is the speed how it moves. But if this speed is slowed down, this speed has any blockage somewhere, water will not flow in its normal speed. It will be filthy, foul smelling. It will create problems, infection. In medical term, you use the infections. It will create infections. So in this way, this hydrocephalus is increased, and even it increases in a large quantity, big quantity. This skull may increase big quantity, and if it's increasing in a big size, even in the mother's wobs, there sometimes we have a normal girth. Girth is the measurement of the abdomen. We have a normal girth of a pregnant woman. We have a normal development of the fundus of the uterus. Means when there is a 12 weeks pregnancy, we can check it and we can judge from the abdomen. Even lady can forget. A lady can forget, I don't know how many months I am pregnant. But I myself, and even the doctors, qualified doctors, the gynecologists, they can tell you, no, your pregnancy is of 12 weeks, 3 months. Your pregnancy is a 5 week, 20 weeks. All these things from the measurement of the fundus, which is going above the bones in the abdomen, we can measure it. But if there is a hydrocephalus, and hydrocephalus is pressing the amniotic fluid inside, it's increasing in size, abdomen will increase in more size. We also have a girth of the abdomen as well. So in this way, if it's developing disproportionately, we have proportions. But when it is abdomen is increasing disproportionately, and in this way, the fundus is also not rising proportionately, disproportionately. That indicates the problems. But nowadays, there are devices we have that we can check this hydrocephalus even at the age of 15th week of pregnancy. 15th week of pregnancy, when head is already formed, when vertebral column is already formed, and when heart at the 5th week, heart is formed in the 5th week. At that conditions, we are now able to detect that a child inside mother's womb is having hydrocephalus. And the reasons are already I discussed yesterday. The reasons, what are the reasons behind that? So we have to take care. If reasons are acquired because of our fault, through mother, although everything is going through the mother, through mother, if it's our fault, then we have to correct that. We have time. From 15 weeks onward, we have to go up to 40 weeks. And if we are able to correct those things, yes, before pregnancy, before delivery, we will be able to correct this hydrocephalus. And if it's a genetically, then we may or may not be able to. And under those conditions, it is sometimes not possible the delivery will be normal. That is why the physicians, the surgeons, doctors, gynecologists, they advise beforehand that no, 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 you cannot have normal delivery. You have to go through the cesarean sections, measuring all these things. How a doctor can tell that there will not be a normal delivery? Because we have a normal measurements of the female genital organs, the you can say the opening of a mother who is going to deliver, especially the pranipara, means which is giving first time birth to the child, first time get pregnant, and after that first time giving birth to the child, that is para, first time. Gravida means first time pregnant. Para means first time giving birth to the mother. So, under those conditions, and I have already instructed all my listeners that a first pregnancy in each case is should be before 25th years of age, because after that there is a different changes inside the bones and their joints. Then it becomes difficult for a girl to deliver a normal child under even normal conditions, because the elasticity or the dilatation of pubic bone is not that much. The normal is 10 centimeter, and normal we assume that the maximum circumference of the fetal head, the head circumference of the fetus which has to come up from the female genital organ is 10 centimeter. And the pelvimetry, that is known as pelvimetry, when we measure the female genital organs in antenatal clinics. Antenatal clinics means when a girl becomes pregnant, she goes to the doctors, and every month they check up everything, her blood pressure, her sugar level, urine checkup, albumin, everything, all these things they check up. That is known as antenatal clinics. And even the changes, development in the fetal, in the mother's body, they note it if there be any problems, because there are many more other complications we will discuss later on, that there are other complications which occurs in the mother's body during pregnancy. So in antenatal clinics, we check up all these things, and in this way, before delivery, we check up the pelvimetry as well. And if the pelvimetry shows us the dilatation of the pubic bone, vague formula is fist. If between the bones, female structures, bones, if your fist, this is known as fist, if fist is fitting into that outwardly, then it's normal. Then it can expand a little bit to make it more than 10 centimeters. But if it is less than even your fist, then it is difficult. This type of problems sometimes may be in the mother's congenital problems as well, because structural problems, just like a lady is having polio, just like you have seen the persons who are having poliomyelitis, that's a viral disease, and by which their leg is not working, leg is slimming, not getting proper nutrition and not developing in musculatures and all that. You know that you have might have seen that the polio legs, and it may affect any part of the body. The same way, if the hip joint has been affected by the polio in the previous life to a girl, under those conditions, even everything is normal. But even then, the pelvimetry may not be normal. And if the pelvimetry is not normal, she cannot deliver a normal child under those conditions. Even the head is normal. If head is abnormal, having hydrocephalus, that is different. That is secondary, secondary complication. But if head is abnormal and the pelvimetry is normal, even then it's a complications. If head is normal and the pelvimetry is not normal, it's a complications. So, under those conditions, we have to check all these things before 40th week of pregnancy so that we can advise the lady for the further course of delivery. Okay, when you go into delivery means labor pain starts. Under those conditions, you cannot deliver a normal child through the natural process, natural via vaginal delivery, that is known as vaginal delivery. But if it's normal, then it's normal. That is why we need to check up all these things. We need to check up all these things in a routine beforehand, so that if there be hydrocephalus. So this was the hydrocephalus conditions I have discussed with you in today's lecture. Already Punjabi Hindi lecture has already been done with the Radio Punjab today, and English lecture was not done yesterday. So that's why I have completed this English lecture today about the hydrocephalus. Tomorrow we will discussing another anomalies, because all the complications, if I will repeat that, it will take more time. But even then, if you people who are listening regularly, I know the 60 70 people are every day clicking my channels and listening all these lectures, and if you people advise and you want to listen it again, then yes, tomorrow I will again repeat this hydrocephalus, the further complications, causes, sign and symptoms in the even after birth in a child, all these things, even in adult persons. If a person is having hydrocephalus and it was having during childhood, and now he is adult at that time, what will be the complications in that one? So if ever you want to listen that, yes, tomorrow I will continue the same thing, and to to give you the directions that these are the complications in adult persons when they are having hydrocephalus. So we are stopping today, because now we are advancing the other problems of the brain, just like autism. That's a big problem nowadays. Most of the children are suffering from autism, ADHD, because of the vaccinations. It's a viral disease. It's a viral type of things, and it's a genetical, sometimes congenital problems too. So many other reasons are there. So autism and ADHD is a brain problem, is a problem of the nervous functions. We see many children in that. So we have to discuss further this one. But if you people advise me to deliver this hydrocephalus and its reasons, and what are the symptoms and signs, and what are the other sicknesses a child can suffer if he is having hydrocephalus, then I will again repeat it tomorrow. Otherwise, I will go to the autism and ADHD. That's another brain problem. So today we are stopping this lecture here, and will join tomorrow. ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਰੱਬ ਰਾਖਾ, ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦੀ ਚੰਗੀ ਸਿਹਤ ਲਈ ਦੁਆ ਕਰਦਾ ਹਾਂ। ਮੈਂ ਗੁਰਦੀਪ ਸਿੰਘ ਸੰਧੂ, ਤੁਹਾਡਾ ਹੋਮਿਓਪੈਥਿਕ ਕੰਸਲਟੈਂਟ, ਤੁਹਾਡੀ ਸੇਵਾ 'ਚ ਹਾਜ਼ਰ ਹਾਂ। 7021 ਵਿਲੇਜ ਪਾਰਕ ਵੇ, ਡਬਲਿਨ, ਕੈਲੀਫੋਰਨੀਆ। At any time, you want to consult me for any disease, from head to heel for any disease, or you want to get treatment, a specific systematic approach to your disease, you can call me at 408-687-1899. And my email address, if you cannot phone me, you can send your message, you can send your history on email to get my opinions about your sickness. That is homeo medicine, HOMEOMEDICINE @yahoo.com. So anytime you can do phone, or you can contact me by emails. Phone number one time again, 408-687-1899. You can call me anytime for any opinion about your sickness. So ਰੱਬ ਰਾਖਾ, ਕੱਲ ਨੂੰ ਫਿਰ ਮਿਲਾਂਗੇ ਇਸੇ ਟਾਈਮ ਦੇ ਉੱਪਰ ਹੀ। ਸਤਿ ਸ੍ਰੀ ਅਕਾਲ, ਆਦਾਬ, ਨਮਸਕਾਰ।